Hello all, welcome, welcome. It's great to have you here. We will start momentarily, just playing around with all my little Zoom windows here. So if you're here for the discussion about sexual and reproductive health in emergency preparedness, you are in the right place. We're gonna get started here in a few minutes, just giving everybody time to come in from the waiting room. And if you have any technical issues, though, feel free to privately chat with Malia, who's on camera, or Fabiola, who is the frog icon. But we really hope that you don't have any technical issues. But if you do, let us know. All right. So I just want to thank everyone for attending today's presentation. Before we officially get it started, I'm going to go over a little bit of housekeeping. Everyone is muted because we're expecting a large group today. If you'd like to share something in the chat, please do. You're welcome to introduce yourself in the with your organization in the chat. It is open for that. We just ask that you be cordial and kind to everybody. And if you have any questions, we request that you actually use the Q&A function. Oh, it looks like the chat is disabled. I thought I had enabled that. Are you able to help us with that, Fabiola?
It's open
Yes,
now.
it should be on now.
Oh, great. Okay. Thank you so much. But please remember to use the Q&A if you can for questions. And if you'd like to turn on closed captions to help understand our speakers, you can do that by clicking the CC icon in the function bar, and you can choose your preferred language. And the recording of this webinar will also have closed captions. So this will be all in English, but if you have another language, you will be able to change the closed captions to that. So again, the event is recorded, and we will email you a copy of the slides and continuing education unit forms after the event ends. So I know some of you may be here for continuing ed units. So after introductions, each panelist will have a few minutes to give a presentation. We'll do a Q&A with a few prepared questions, and then we'll open it up to discussion to questions from the audience. And I'd like to encourage you all to use that question box throughout the presentation so you don't forget it. And we'll work to get to as many of your questions as possible. So next slide, please. So I am your moderator. My name is Kelly Dennings, and my pronouns are she, her. For those that can't see me, I'm a petite, also could say short, white middle-aged woman with short brown hair standing in my home office, aka bedroom. I want to acknowledge that I'm on stolen Miccosukee and Cherokee land, also known as Jacksonville, Florida, where many individuals face displacement and suffering and hope one day they receive restorative measures. I spent 15 years working in waste, forestry, and conservation before getting a master's in public health. And I'm a campaigner with the Center for Biological Diversity, working to develop and execute campaigns that address the connections between reproductive health, gender equity, endless growth, and the climate and extinction crises. Next slide. So first, a quick introduction of the center. We're a national nonprofit conservation organization that works through a combination of science, the law, activism, and creative media to protect wildlife and the wild places they need to thrive. I could have easily said that the center works to find solutions to patriarchy, capitalism, and other forms of oppression as each of these affect people and the planet. I want to welcome those from the One Health community, those in my climate change coalitions, colleagues from the family planning world, and my new comrades in the mutual aid space. It's so important we work intersectionally for the health of people, animals, and their shared environment to achieve optimal health. Next slide. Okay, so before we get started, we're going to do a couple of polls here, and hopefully Okay, first we're gonna find out where people are from. So we're gonna have some presenters here that are doing this work on the ground, and it's just kind of interesting to see if their geography is gonna overlap with where you all are coming from. So it's looking pretty even right now. Um, we've got some international attendees, which is great. I know we've got some folks that has some expertise in that. So there's the results. So 30% from the Northeast, 20% from the South, and 23% from outside of the United States. So thank you all for joining us. And then the next poll here is going to be what best describes the sector that you're working in. And I'm having trouble launching that one. Oh, stop sharing. Okay, here we go. So yeah, let us know. Are you with a city or a municipal agency, a county or state agency, nonprofit organization, maybe a business or consultant, educational institution, that could be higher ed, or a community group. So yeah, I'll give it another minute here. Oh, great. We've got 3/4 have responded. All right. So it looks like we've got, 45% coming from a nonprofit organization, and then 26% from an educational institution. So that's great. We've got some state agencies, but anyway, this has been wonderful. Thank you so much for responding in those. And then I have one final poll for you. This is just for those folks that are looking to get continuing education credits. So you will get a certificate from me that shows attendance, and it has been approved for the CPH credits, but hopefully if you're doing CHES or anything like that, it will work. So I'm going to launch this poll. So if you want me to send you a certificate for continuing ed units, please complete this poll. I'm going to leave it open here for a little bit, and then hopefully you stay for the whole webinar. It is on the honor system, but this will allow folks to get those credits. All right. I think that is slowing down. I'm going to end the poll. I'll make an announcement at the end. If anybody didn't grab this, you can let me know. Okay. So next slide, please. So with us today, we have Risha Hess, Principal Consultant at Propa Elevate. Hopefully I'm saying that right. Kylea Hughes, who is an intern with the Center for Biological Diversity. Rachel Kinbar, an organizer with Central Florida Mutual Aid. And Kimberly Smith, the co-founder of State Line Abortion Access Partners. So prior to each of their presentations, I'm going to read a short bio. So, all right, over to Risha. We'll see the rest of our presenters when they pop on. Thank you so much. So Risha is going to give us an overview of climate change, its tie to extreme weather, and the impact on healthcare and the way to build resilience. Risha is a maternal, sexual, and reproductive health specialist. As a principal consultant with Propelevate, and hopefully you'll correct me if I'm wrong, Risha works to support global organizations enter new geographies with health products, build alternative revenue models, and create more inclusive strategic plans that consider decolonization, climate, and patriarchy. Prior to this position, Risha was the country director of MSI Reproductive Choices in Ethiopia, and she was with Population Services International. She's worked in over 15 countries, and she has a BA from Boston College and an MBA from Georgetown University. She's the chair of the Town of Amherst Board of Health and the treasurer of the board of the Amherst Survival Center. Over to you, Risha. Thank you.
Thanks so much. And you got it on the second try, Propelivate. So thank you all. It's incredible to see so many participants, and I'm really excited to see such a mix of geographies. So bringing together a lot of our community movements globally. We can go to the first slide. So I'm not going to get too deeply into the specifics of climate change, but I do want to emphasize that different geographies have vastly different experiences with climate change. And we are going to be focusing today on responses to sudden onset. So that's like storms or forest fires, wildfires. And there are specific responses that we want for that, but just to remind everyone that there are slower onsets, so the changes in precipitation, the changes in temperature and sea level rise, that all do also impact sexual and reproductive health and rights. We can move on to the next slide. And so just giving you some headlines on the research on the connections between climate change and sexual and reproductive health and rights. We'll start with gender-based violence and interpersonal violence. This is one of the strongest correlations that we find in the research. For every 1 degree Celsius rise in global temperature, they're modeling a 4.7% increase in interpersonal violence. We have found increases in femicide, that's killing of girls and women during heat waves. Several studies have been able to show significant increases in interpersonal violence following Hurricane Katrina specifically. And in the US, there is a linear relationship between temperature and rape. In other sexual and reproductive areas, maternal health, for instance, there's actually a direct link between heat and air pollution and maternal outcomes and neonatal outcomes. There are a bunch of other things that are related to those slower onsets, so we're not going to emphasize them today. And in sexual health, HIV is one of the areas where we see the most data. Staying with Hurricane Katrina, we have seen worsened HIV clinical outcomes after Hurricane Katrina. And possibly not surprisingly, these outcomes are worse in certain groups. It is an inequitable response. So in Hurricane Katrina, it was African Americans, male, and older individuals who were impacted the worst. Next slide. So how is that happening? There's 4 boxes here. Today, we're really going to focus on the top left, the weather-related disasters. So these include drought, storms, flooding, heat waves, and wildfires. And when one of those happens, there's 2 ways that it impacts sexual and reproductive health. The first is direct, as I just mentioned. Heat impacts the body's ability to regulate, and therefore has direct implications on carrying a child to term. Just so you know what those other words mean, changes to pathogens. So for instance, heat and humidity impact the TB virus and its ability to spread. And heat and humidity also affect where mosquitoes that have things like malaria are able to thrive. So in most cases, sexual and reproductive health is impacted indirectly. It's not a direct, but an indirect implication. And there's 6 pathways that we've found, and they all interact with each other and really make each other worse. The first is human migration. So in weather-related disasters, this is just temporary displacement. You get increased prevalence of other diseases, specifically waterborne, so cholera, diarrheal disease. Increased food insecurity, either you're cut off from your food sources, the supply chain breaks down, making things more expensive, or if you're growing things locally, the nutrients can be affected and it's not as healthy. All of that combines to increased economic stress. So if you've lost your job, if you're displaced from your area, if everything's costing more, if you're having increasing medical costs, all of that creates economic stress. And I just want to emphasize the word stress, because stress has a direct impact on our health. And so even just worrying about these aspects is quite harmful. That in turn can always increase conflict. So this is where we saw both gender-based and interpersonal violence, but also at national levels, at community levels, as folks fight over resources. We see increased discrimination and blaming of populations. For instance, after a volcano in Tonga, I spoke to a trans woman who was, when she went to seek services in the shelter, the folks there said, well, it's your fault that this volcano happened because God is punishing us for trans people, and therefore was abused. So we see a lot more conflict. And then, of course, the erosion of the health infrastructure. So the clinics can be destroyed, the supplies can be destroyed, the supply chain can be broken, the health workers can be displaced, all of it making it harder for us to get the services we need. Combine all those and you get reduced access to health products and services, increased risk situations, both things like rape, but also sex work and sex work without condoms, increased comorbidities, which has a particular impact on folks with lowered immunity, and the decreased nutritional quality. Again, this is something that is needed for folks who are already on medication for medications to work well, particularly ART. And you can click one more time because as many of you probably know, none of this hits equally. The harms and impacts of these events are not shared equally. So climate change exacerbates existing inequalities that limit people's access to sexual and reproductive health and rights. And across sectors and regions, the most vulnerable people and systems are observed to be disproportionately affected. And we also have to think about the baseline capacity of the health system you're living in. If your community is already in an underfunded or restricted health desert, the impacts will be much greater. So next slide. As one specific example, if we look at the winter storm Uri in Texas in 2021, so this ice storm, killed over 100 people directly with hypothermia, but it was in Texas. And if we think about the abortion situation in Texas in 2021, you had to wait 24 hours from your first appointment, meaning you needed multiple appointments. You needed ultrasounds, already a very restrictive place with very few providers able to give services. So once people were either locked, frozen in their homes, or displaced by the storms, they were not able to reach by 22 weeks, and so then were unable to access services. And the clinics there were rescheduling thousands of missed appointments, which impacted all sorts of broader sexual reproductive health services that they could give. Next slide. I didn't want to leave you on just the negatives and how awful this all is. The rest, I promise, the rest of everyone else's talking will be about what we can do. The climate people talk about interventions in 3 buckets. The first is adaptation. And this is really dealing with the realities that climate change is already bringing. So a lot of the work we'll talk about is in that space. In mitigation on the far right, that's trying to prevent more climate change. And this is not going to be the focus of what we talk about, but I do want to emphasize that health systems contribute about 5% of greenhouse gas emissions globally. That's more than all air travel. So it's not to be taken lightly. And in the middle, resilience I think of as a systems level, so really making sure that our health systems are climate and disaster smart and can continue to operate and prevent disease and increase well-being. And so something like solar panels on a health facility would be an example of a resilience measure. I then also just want to quickly state that every kind of disaster has very similar implications for our communities. So we're talking about climate disasters today, but the same kinds of preparations would be needed for any other kind of disaster. So an example of that would be the East Palestine, Ohio train derailment. And I'll hand it back to Kelly. Thank you.
Wow, thank you so much, Risha. That was wonderful. That was really setting the stage for us and within the time limit. Oh, wonderful. All right. So with us, we have Kylea. I'm gonna introduce her just briefly here, but she's gonna tell us about the center's Sexual Health Emergency Preparedness Kit campaign and her upcoming emergency preparedness checklist scorecard report. But first, I'm going to give you a little bit of background about how we got here and Kylea's work. But we actually did a couple of other reports. One was in 2022, where we did a report around gender and the climate crisis, looking at gender in climate plans. And I think Malia may share these in the chat. They will also, we can share them out afterwards in the follow-up email. And then also in 2022, we did a report called The Influence of Environmental Toxicity, Inequity, and Capitalism on Reproductive Health. And in there was a chapter both on fossil fuel extraction and climate change. So these reports really put us on the pathway of working on this connection between gender and climate. And we also did another great mutual aid project when researching alternatives to capitalism. So what you're seeing here is really a culmination of a couple years of work. And then I will say how we came about picking up this idea of sexual health emergency preparedness was Malia and I were chatting with our comms person one day, and we were thinking about potential writing opportunities. And there were these like social media posts going around about like what's in my bag. And so we were kind of riffing off that, but instead of like doing a social media post about it, we decided to actually like make, what would we put in our go bags if we were in a situation, and how what would that look like in the sexual health world. So I then piloted this in Florida in 2024, which you're going to hear about from a colleague of mine. And then we said, hey, that worked really well in Florida. Let's bring on Kylea to take this to the next level. So she holds a background in biology and has conducted research across several areas, with her current focus on memory loss, mild cognition impairment, and Alzheimer's disease. She is in her final semester of a master's in public health program specializing in health promotion. As part of her program, Kylea is interning with the center where she works with me. And she created all this great work. She is a month out from finishing, and we're so excited to have her. Yeah, and she's done so much in the short time she's here. So Kylea, over to you, but you're welcome to keep camera on or off.
All right, hello everyone. As Kelly mentioned, my name is Kylea Hughes, and I have the greatest opportunity to be the Sexual Health Emergency Preparedness SHEP campaign intern. For those who can't see me, I am a short African American woman with curly dark brown hair and large frame glasses, and I am sitting at my desk. So next slide, please. All right, so on this slide, I just want to introduce everyone to the SHEP campaign. So SHEP serves as a bridge connecting climate resilience, reproductive justice, and gender equity. In emergencies, people often lose access to essential sexual and reproductive health supplies, and so SHEP helps to fill that gap. So each SHEP kit can include items such as condoms, emergency contraception, lubricant, menstrual products, over-the-counter birth control pills, pregnancy tests, and educational materials. And these items basically help to support immediate needs, people's immediate needs, and then also it helps individuals to learn how to incorporate reproductive health into their own emergency preparedness plans. So beyond the kits themselves, the campaign strengthens partnerships with community groups and mutual aid groups that are already supporting people during crises. And importantly, SHEP raises awareness about the connection between climate change and reproductive health, building public support for long-term changes in government emergency preparedness programs. Next slide, please. All right. So on this slide, I want to briefly walk through the primary goals of the SHEP campaign, which guide both our outreach and our vision, long-term vision. So our short-term goal focuses on meeting immediate needs. SHEP aims to fill the current gap in sexual and reproductive health resources while also educating people on how to integrate these items into their own emergency preparedness plans. Our intermediate goal expands that impact by increasing public understanding of how climate change and reproductive harm are connected. We work toward this through digital and traditional media, community events, and public engagement. And finally, our long-term goal is to shift the broader narrative around emergency preparedness. We want sexual and reproductive health to be recognized as essential, something that is routinely included in emergency preparedness checklists and not treated as an afterthought. Next slide, please. All right, so on this slide, I am going to outline the 6 steps from the SHEP How-To Guide, which was released in early September. And so these steps will basically walk you through how to host your own SHEP event from start to finish. And the first step is to identify collaborators. So you want to ask yourself, who in the community could benefit from these kits? Then think about who could contribute to making this campaign successful. This might include people who can offer resources, people who can help distribute kits, or organizations that are already connected to those in need. So a great starting point is to look for partner organizations that already provide items found in SHEP kits, such as clinics, mutual aid groups, or sexual health organizations. And then the very next step is essential, and that is conducting needs assessments. So needs assessments allows you to understand what the community already has, what the community needs, and any gaps in services. So basically, you're trying to get a better understanding of the community you plan to serve. And so that can be done through primary data collection, which are surveys or interviews, or through secondary data collection, which comes from existing data. And so through these different data collections, you can learn which items are most needed, which locations are feasible for hosting events, how community members typically receive information, and what potential barriers might exist. And then once you understand those needs, you can begin to set campaign goals, which you want to use the framework SMARTY, which stands for specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. All right, and then the next step is to identify your locations for hosting SHEP events, which is built upon the needs assessment. So you want to consider things such as accessibility. Is this location easy to access without a car? What are the hours of operation? When do community members typically visit? And so some ideal locations could be maybe libraries, public parks, food banks, or community centers. And step 4 is to start building your inventory, so gathering your kit supplies. So for this step, you want to lean heavily on your partners. They may have resources to donate, or they can point you toward organizations that do. And so some common SHEP items, as mentioned before, are condoms, emergency contraception, lubricant, menstrual products, over-the-counter birth control pills, pregnancy tests, and educational resources such as zines or stickers. And so once you have your supplies, then you want to start to spread the word. So this also utilizes your needs assessment as well. And so this is promotion. So promotion can look like emails, flyers, word of mouth, social media posts, QR codes, or even radio or news segments. And you basically want to choose the form of communication that's best to reach your target audience. And the final step, which I think is second important, next to the needs assessment, is tracking your performance. And so this step basically helps you understand how impactful your events were. Like, were you able to meet your community's needs? And if not, what can you do, to make sure that your next event is impactful? Next slide, please. All right, so here, along with the how-to guide, the SHEP webpage also includes several helpful resources. This first one that I'm highlighting is a budget template, and this tool basically is designed to make planning for your SHEP kit distribution events much easier. And the template basically helps you to map out both potential donations and any expected expenses. One thing that makes this budget very user-friendly, rather, is that all the cost formulas are already built into the Excel file. So instead of doing any calculations by yourself, all you need to do is enter in the quality, I mean, not the quality, but the quantity of each item, rather, and the unit price. And then the spreadsheet will automatically update the totals for you. Next slide, please. All right, so here is the next resource, and there's different formats of the zine that are on their webpage. And this zine in particular is basically giving instructions on how to prepare for disasters and why, but zines can contain different information regarding the work that we're doing. Next slide, please. All right, and so the final slide is basically providing an overview of a report that I've been working on, which is scheduled to release in mid-December. So the checklist scorecard basically evaluates how well states included sexual and reproductive health items in their emergency preparedness checklist. So basically, to build the scorecard, I reviewed checklists from state departments of health, emergency management agencies, official state websites, or if none of those had those, I utilized the FEMA's Ready initiative if the state provided a link to that. And so the scorecard evaluates basically 4 categories, which are menstrual products, medication, personal hygiene, and sexual and reproductive health products. So while menstrual products could technically fall under sexual and reproductive health, they are separated because they are often the first items people associate with sexual reproductive health. And then the sexual reproductive health category covers items such as condoms, pregnancy tests, and birthing supplies. And then medication is scored separately because it represents a broad range of health needs beyond sexual reproductive health. And then personal hygiene was included because maintaining hygiene is closely linked to preventing infections and health complications related to sexual and reproductive health. So after scoring all 50 states, I found that only 2 states, Maryland, which I'm happy that I live there, and Rhode Island, included sexual and reproductive health items in their checklist. So Maryland actually scored a perfect 4, and they included condoms to cover the sexual reproductive health item. And then Rhode Island scored a 3, and they included birthing supplies. And so this scorecard basically will serve as an important tool to highlight gaps and encourage states to adopt more inclusive, comprehensive emergency preparedness guidelines moving forward. And that's all for me. Thank you everyone for your time.
I mean, y'all, Kylia has hit it out of the park for a part-time. She definitely, I love all the kudos in the chat here because she deserves this MPH. She really does. So I know you got some MPH colleagues here on the call. So yeah, I am really excited for this scorecard report to come out. There's some love in the chat. So please email me if you want to know when that scorecard report comes out, or email me that you're interested and I'll make sure you get it. And the other thing that we didn't mention was on the right-hand side of that screen where, you know, the SHEP how-to guide is, there's all these resources. One of the things that's also on there is a So Kind wish list. Malia may put that in the chat, but if you're not familiar with our So Kind website, it's essentially an alternative wish list and give site where you can connect with people all across the world, really. So if you don't want to use Amazon, this might be an option for you. So I also wanted to highlight that. But yeah, isn't it amazing how many of these checklists don't include this? And, you know, it's so important, these medications, whether it's, you know, hormone replacement therapy or gender affirming care. So we need to make sure that folks remember that during an emergency. All right, before I turn it over to Rachel, for those of you that came in midstream, perhaps, introduce yourself in the chat, please. Feel free to put your questions in the Q&A section. Don't have to wait till the end. And if you maybe missed the CEUs, message me about that also. Okay. So up we have Rachel. They're going to talk to us about mutual aid broadly and their SHEP distribution event, along with other emergency preparedness and response work happening in Orlando. So Rachel is an organizer with the Central Florida Mutual Aid and Director of Operations for Beautiful Trouble, as well as a former Alternative Economy Fellow with the Center for Biological Diversity. Their work centers around building a new commons in Central Florida and beyond. They are going to, oh yeah, Rachel taught me so much about mutual aid when they worked with us. And so I'm excited for you to tell everybody about your work. I really appreciated you. I appreciate you still.
Thank you, Kelly. It's been great to hear these other presentations. I've already learned a lot and hopefully I can continue that streak. So if we can go to the first slide, please. Thank you. So yes, I organized with Central Florida Mutual Aid. Everyone who's part of this group is just regular folks. No one's getting paid for this work. This is just what we believe in, meeting each other's basic material needs. We're functioning in Orange, Osceola, and Seminole counties in Central Florida. And like many mutual aid groups, we are democratic, decentralized, non-hierarchical. And we really focus on centering the needs of those most impacted by systems of oppression. And we do that mostly by listening to our members who are the most impacted. So this is really ground level work. And that QR code there goes to the general Central Florida Mutual Aid link tree. Next slide, please. So this is a little bit about the difference between mutual aid and charity. As Kelly mentioned, I do work for a nonprofit. That is my day job. That's how I get paid. That's how I pay the bills. So I'm not anti-nonprofit, but mutual aid definitely serves a niche. Our members are the people making decisions and not people who are donating money. So we really have control over how things are spent and what the money is going to. Our efforts support the people facing most dire conditions, and we don't have a lot of imposed conditions. So if people need something, we do our best to meet those needs. We don't have paperwork. We have some forms, but just really to facilitate the process, not because we're checking or validating people's requests. So it's really a low barrier to entry, both organizing with us and receiving support. And that goes along with the next thing. We give away things without expectations. We're not expecting anything in return. It's not a, like we're not collecting data for funders or anything like that. So it really makes our work also very quick and agile because we don't have to do all of those, many people working in nonprofits will know, very labor intensive data collection and reporting. And we value self-determination. So the people who are most impacted have the agency to say what they need. We are not telling them what they need or assuming what they need. We are figuring out together how to meet those needs. And I'm not going to go into all of the charity stuff. I'm sure you were reading it on the screen. It's basically just the opposite of the things that I said. And there are reasons why nonprofits and charities have those systems in place. And mutual aid really serves to fill the gaps that are created in those systems. And there is, if you look up Dean Spade, there is a mutual aid chart that actually has a much longer list comparing these two things. And I encourage you all to look at that if you are interested or curious about it. Next slide, please. So we were very excited to be part of the SHEP pilot project that the Center for Biological Diversity coordinated. We were one of a few groups who were part of it. This is us last year. We were at a really free market in West Orlando in Pine Hills. And you can see we have other things going on too. We can't help ourselves. So we also were giving away like a lot of clothes and a lot of household items. And we had a full table of SHEP kits. So we had in the paper bags, if you can see those on the table there, those were the assembled items that Kylia had mentioned in their presentation. And then we also had individual items out on the table because not everyone has the same needs. And that way people could take the things that they really needed and not have the other things. Because there's a possibility if people take a full kit that they only need some of the things and other things get thrown away. And we certainly don't want that. We make the most of our resources since we have limited resources most of the time. But that event, it was very well received. People were always like, are you sure we can take this? Is this really for free? And we have that at all of our events. And yeah, we also have everything for free on demand all year long. The thing that makes SHEP really interesting is that we highlight the need to prepare in advance of a hurricane, because many people don't even think about that. They're thinking about food and water and like really basic stuff and not even thinking about medical supplies necessarily or period products or sexual and reproductive health items. So just having these things available and really making them available for free makes such a difference for many people, because the greatest obstacle that we have seen is not that people don't want to prepare or that they don't have information on how to do it, but they don't have the funds to do it. So if we are able to supply some of these items so that they can take those things off their checklists, that's makes the whole project worth it for us. Next slide, please. The weekend before last, we did another distribution, and this was at the Maker Faire. We were the only organization that was giving away any kind of distro products like this. And initially, people were confused because it was a Maker Faire. It was not anything to do with disaster preparedness or sexual or reproductive health. And on the first day, we ran out of items and had to bring new of everything the next day. And by the end of the second day, we had again run out. And so we've never had that much of a positive reception to everything or that much foot traffic either. So sometimes coming up with unconventional venues or events can actually make a project really, really successful. Next slide, please. So while I was working with the Center for Biological Diversity, this really dovetailed well with some of the projects that Central Florida Mutual Aid was doing. We had already created this hurricane season shopping guide, I believe, like shortly before my fellowship began, but we absolutely had left off some of the items like what Kylea was talking about. So I don't think we had I don't think we mentioned condoms or anything like that. We did have medical, like if you have medication or things like that, those types of things, baby supplies. But yeah, we had also left off period products. So we went back and revised it. And so now that is included in the shopping guide. This also breaks it down so you can start in it like before hurricane season begins, which is June 1st. It goes June 1st to the end of November. It's half a year. But yeah, so the idea is that you can add a few items to your shopping list each week. So it kind of just makes the preparedness aspect of it a little bit easier and also a little bit financially doable because it's not buying everything at once if you don't have enough funding for it, but just a few things each time. So that's the QR code that goes to that. If people are interested in that, feel free to check it out. It's very shareable as well. Next slide, please. Oh, and something about the previous one, I see Malia just dropped a link in the chat. We do have a couple of worksheets that go along with the guide. So you can check those out as well. Additional preparedness projects that we have a monthly sustainability gathering that we co-host with another local organization called Blue Trunk Community Network. And we do different things. This was a co-event with our Central Florida Tool Library, which is another project of Central Florida Mutual Aid. And here we were doing a Chainsaw 101 workshop where people got to actually use chainsaws, try it out in a safe, instructed way. And this is a really great thing, both in terms of preparation and response to hurricanes. Everyone has seen a lot of downed trees around hurricanes, so this is a familiar sight. And having those skills is so valuable. And then the picture on the right there, we were creating a garden for someone. So this was a community member, actually someone who runs the local neighborhood fridge, and they wanted to start growing more produce in their own yard. And so we set up a garden during one of our sustainability gatherings. Next slide, please. And here we are back at the Maker Faire. So we were there as Central Florida Tool Library. And this was a project that was started last year. We opened this year, but we started last year. And it's been a labor of love, and we're very happy that it's out in the world now and open for members. It is a publicly accessible tool library. We do have some suggested donation amounts for membership, but it's also like no one will be turned away if you can't afford it. And this is located in West Orlando, where we've done a lot of hurricane response work. And we have a full line of Milwaukee tools. We have a lot of hand tools. We have things that are specifically for like mold remediation and hurricane response. We have some medical supplies, kinds of things that are really expensive and you may only need to use once or twice and then don't have a use for it again. We have some camping equipment, sporting equipment, also arts and crafts. That was always, when we did a survey, people were like, please, more arts and crafts supplies. So we have a lot of tools for people to try out different things like that. I'm pretty sure I'm forgetting some things. We have power banks, different types of things. So that's a project that we've been doing. This dovetails really well with our other hurricane preparedness work, disaster preparedness. And at this booth, it was very popular. We just gave people an opportunity to try out a hand drill. It's really simple, easy, and you'll be amazed how many people have never tried a hand drill. And a really interesting fact, and one of the reasons we started the tool library, is that over the course of its life, the average hand drill is used for 15 minutes total. And so by having the tool library, we reduce waste quite a bit, and we actually give tools extended use over their life because they are used more frequently and put to greater use by more hands. So that QR code goes to another link tree, which is specifically for the Central Florida Tool Library. And that, I think I have maybe one more slide.
We're over time. Yeah.
This is just a little bit about how it works, which it's a library. It's similar to any library. We have limited hours, but yeah. And then that QR code goes to the homepage of the tool library.
All right. Thank you, Rachel. All right, y'all. Appreciate this. So now over to Kimberly rounding us out. And so she's going to discuss their kit distribution work, how it's funded and different logistics. So she's a co-founder and board president of State Line Abortion Access Partners. She's dedicated 25 years to the reproductive rights, health, and justice sector, primarily as a fundraiser. A Tennessee native with an MSSW from the University of Tennessee, she returned to her hometown in Bristol, Tennessee in 2017 with the goal of bringing more resources to progressive movements in Appalachia. Her career includes roles at Planned Parenthood of Delaware, Planned Parenthood Federation of America, and Doctors Without Borders. In 2015, she joined Abortion Access Front as their development director, and she continues to serve as their foundation giving officer. In 2013, Kimberly co-founded State Line Abortion Access Partners with fellow activists, where she is responsible for fundraising and general operations. I first learned about Kimberly's project on Abortion Access Front's podcast, Feminist Buzzkills, and so we should maybe try to drop that in the chat too. But I'm so excited to have you on today. Over to you, Kimberly.
Hi, thanks so much for having me. It's been an interesting journey to learn about a bigger movement behind something we were already doing on our own. So, it's nice to know that we should be looking further afield for more resources. I will say that SLAP was actually founded in 2023. I may have typoed in my bio, but we are a very young organization. And you can start with my first slide, please. So yeah, we are in what is largely called Central Appalachia. We are right on the Tennessee-Virginia border. And Bristol is an interesting community in that it has had an abortion provider for 40 years, but that abortion provider was in Tennessee. So when Dobbs fell, that clinic was relocated just across the state line into Virginia. So I come from a group of activists who got to know each other through clinic escorting. And when Dobbs fell, we sort of felt like there was something we needed to be doing, more than just sitting on our hands and complaining. So what really prompted the founding of State Line Abortion Access Partners was a push for abortion zoning restrictions. They were trying to zone the existing clinic out of the town. And we came together and created this organization for a platform to sort of hold space for pro-abortion Appalachians so that our voices weren't getting lost in that it was clear that Appalachia isn't a monolith around these issues. And we were successful in defeating those measures, which sort of let us start looking to what we wanted to do more broadly. And, you know, Appalachia, and specifically our area, is historically very socially conservative and very poor. Over 22% of residents live below the poverty line. And in the 2024 election, Republicans won rural counties in this area by a 55% margin. So it's an interesting context to be trying to do this work. But we were very determined to sort of start addressing this big stigma and medical desert that we live in. There's also a healthcare monopoly that's greatly impacting the region of Northeast Tennessee and Southwest Virginia, in addition to all the poverty issues. So, you know, we wanted to find a way to offer tangible resources to help people control their reproductive destinies in a way that might also reduce stigma around those conversations, and just sort of start opening, you know, opening people's eyes and their hearts and their, you know, attitudes around comprehensive reproductive health care. So since 2023, we've been extensively distributing sexual health supplies, including emergency contraception, condoms, lube, pregnancy tests in various contexts. We create abortion aftercare packs for distribution by abortion providers in our region. We are working extensively with mutual aid and other organizations that serve various populations in our community. We table at festivals and college campuses and distribute materials. And we respond directly to requests from individuals by shipping them requested supplies if they're not in our immediate vicinity. So that all those programs have been growing by leaps and bounds. But one thing that we found, I just want to put a particular lens on this with regards to menstrual supplies. Given that there's so much stigma around discussing sexual health, we found that period supplies were a really good point of access for people. And I mean, it really is the start of reproductive health care needs. So period poverty is huge in our area. The lack of menstrual supplies is very real here. It impacts, you know, people seeking education. And it's been a great starting point to engage with people and organizations, because it's a little less scary than talking about the larger sexual health care needs. And when we start engaging with people and offer them these really, you know, real, free, no strings attached, unless it's tampons, supplies, they get to know who we are, what we're about, and it's been moving the conversations along. And we really have seen the needle move on organizations that would first only take period supplies from us. And then as they got to know us and we've had conversations, they started taking condoms and lube, and then eventually emergency contraception. And of course, in addition to all this work, we're also connecting people who need help with abortion funds and practical support organizations to help them find abortion where they need it. So we were very much dwelling in the sexual health preparedness sphere, but we weren't in the emergency sphere until Hurricane Helene. So we can go to the next slide. This was a truly unprecedented disaster for our area. You know, most people saw this on the news. It was, you know, the flooding was incredible because of the mountains and the rural, you know, makeup of our area. Communities were cut off entirely. And also it was sort of hard for people to understand the scope of the damage, because cell towers had gone down during the storm, and it took sort of almost 12 to 24 hours before people truly understood what was happening in these isolated communities. So as we learned about what was happening, you know, of course, we're like, well, we have things that can help. And we were just sort of looking for the early sort of like list and where we could take things. And I will say that I I was shocked because some of those early lists that came out, and again, you have to understand this is not an area that was prepared for this. So this kind of emergency, this isn't like Florida or California. No one was prepared for this kind of thing. So lists were coming out ad hoc, and I was not seeing menstrual supplies on them. In fact, I saw adult diapers twice before I saw menstrual supplies. There would be like this generic hygiene category. And I thought, wait a minute, this is really just another space where we need to get involved. And luckily, because we are very much tied to this region, our members have deep ties to a lot of the communities that were immediately impacted. Our area, Bristol, was not severely impacted, but all around us, there were communities where we already had connections and were doing work that were. So we were able to jump in very quickly. And you can go to the next slide. And luckily, there were things that we already had in place that really served us well in this. So for one, we had all the supplies we wanted on hand, and we did our first drop the day after the hurricane, because one of our members had a sister that lived in that community. So we were able to very quickly, connect and know where those supplies needed to go. The other thing that helped us with the network is that we were featured very early on as a resource in social media and press. We did use social media early on, just saying, hey, if anyone needs these supplies, we'd love to get them to you. And that got picked up. So we were featured in a lot of press placements, and people found us. So that was also nice. We were already part of the mutual aid networks that serve this area. So in these emergency contexts, I think there's this big need for people to help. But honestly, the people that are going to do the best job, if there's not already a big emergency preparedness network, are going to be the people that know how to distribute things on the ground and are working already. So we were already part of that network. And we were, as I mentioned, we were widely networked with people in this area. The other thing that let us continue to do this work, and it was a long recovery, was that we had a wish list that was promoted by our partners that weren't in the immediate this part of the country, so that people who wanted to help outside could send us menstrual supplies, which is our biggest expense. We get a lot of our other stuff for free, but that was super helpful to have those on hand and to be able to continue saying yes as people ask us for help. And then the other thing I want to point, because I know I'm already going a little bit long, is that again, the menstrual supplies were very helpful for us. This is very conservative, very rural. We did not just drop off boxes of emergency contraception in these communities. What we would do is we'd go in with a box of menstrual supplies, which we knew anyone would be interested in taking. And then once we got a lay of the land of like sort of who was in charge and what the scene looked like, and we could talk, we would try to, explain to people these other supplies we had. And if there was receptiveness around that, we would leave the EC and the condoms. Sometimes there wasn't, or sometimes that was a great point of conversation to, one thing that would be said is like, no one's thinking about sex at a time like this. And we were like, well, this is a long recovery, and people deal with stress in a lot of different ways. And pharmacies are gone, and people have lost access to their regular forms of birth control. So that often would just sort of like jar people into the reality of what was happening. And then we felt good about leaving those supplies. But what we didn't do was go to the really largest bulk distribution centers. And there were a couple, because we knew our supplies were just going to get lost, and we didn't want them to get thrown away by someone who didn't agree with what we were doing. And also, there's still a lot of confusion about the difference between EC and abortion pills in this area. So we wanted to have conversations to make sure these things would land where they could be used. So you can move to my next slide. This is just sort of the scope of where we were able to reach through these. We were in various parts of Asheville, in North Carolina, that's Western North Carolina, Northeast Tennessee, and then Southwest Virginia. We were able to network through either taking things ourselves, passing off to individuals that we knew could get them to that area. And something that was very fortuitous is that one of our board members and her husband had 4x4 all-terrain vehicle. So they were actually tapped to go into some of the really rural areas that weren't reachable by car, and we were able to take things there. And then you can go to my last slide, and that just shows sort of the amounts, the quantities, which you guys may be interested in. Again, the EC, we could have distributed more, but we were just careful about where it went. And you can see that the menstrual supplies were very, were very easy to distribute and utilize. So that is the story of how we stumbled into emergency preparedness. But it was a really eye-opening and interesting, situation to be part of. And I think, although some of our stuff was luck, I do think there are lessons to be learned in the way we worked through the situation. Thank you.
Thank you. Thank you, Kimberly. And we had so many great speakers. I crammed them in, y'all. I know we have not left enough time for the Q&A. We will not do our curated Q&A, but there are a few in the chat if folks want to come off camera here for a little bit. I will get us through these and then close us out, and we will head out. But we did have Judy in the chat, who works in kind of infant and maternal needs. And I thought, Kylea, I know when you did the scorecard checklist report, you did look for birthing supplies, which isn't quite infant and maternal health. But do you remember seeing anything like that when you were reviewing the checklists for, breastfeeding supplies or anything like that?
No, for the most part, Rhode Island was the only state to include that. Now, they did include items such as infant items such as diapers and things like that, but no other items were really included for the state, each state.
Yeah. Judy, it's such a good question because we're still in silos even in this regard. I hear what you're saying, infant and maternal health along with sexual and reproductive health, and then you've got us as kind of like the enviro climate people. So does anybody else have thoughts on how to, build these intersections even in that regard? Risha, I know you really do a lot of work cross-sectionally with.
I don't think, every situation, so the folks that are in the US are different than the folks that are outside. And so trying to point to specifics gets hard. I will say, I think what I liked about Rachel's presentation is it's beyond health, right? It is also the tools and the actual recovery. The more that you can meet people as their whole being and all of their needs, and not just say, oh, we're here just for your baby or just for your sexual needs. I think the better we'll do. I think Judy's question is just a great prompt to all of us to be better at it.
Yeah. Kimberly, I was gonna ask you this one from Baloli, I think. I'm kind of summarizing here, but you work so does Rachel, in a conservative area. So what's your advice to somebody in, you mentioned kind of the intro with menstrual products, but any other advice for somebody in a more conservative area to start this?
Yeah, when we talk about this, we don't talk about it from the political level. We talk about from the human need level. And I think when you take that sort of stigma out of it, it becomes easier. We offer all of our supplies to anyone who can use them whoever they are. That means we've been able to work with some surprising partners. We do work with ministries. We work with an evangelical ministry. We work with public schools. And some of these places can't talk about who we are and that they work with us, but we don't care. But what that does is it lets us move the needle on an individual level with people who are in communities and have connections. And I think it's just that's how we have to move forward, is sort of take the incremental wins and just be seen as a great community partner. And we will interact with people at wherever they are. They don't have to buy the whole kit and caboodle of what we do as an abortion access organization. And I think that's been really successful for us.
Thank you. And Baloli had another question here that I'm going to try to answer that, Some have confessed having, abortions because of the discomfort that comes with increased temperatures in the southwest region of Cameroon. And I know in one of the other reports that we did, we talk about kind of that adaptation that Risha noted, what are ways to adapt to this heat, and, providing, I've never been to Cameroon. I'm sure it's hot, but it can get hot here too. And, death from heat is a reality. And, getting people fans and portable air conditioners, and that is a way to adapt to extreme heat. And, our public health systems need to be able to provide those to help people weather that extreme heat. So again, one of the more wealthier countries in the world, we also don't provide that to our citizens the way we should. Well, thank you all so much for your questions. We answered some of them in the chat. We have somebody here asking about partnering with insurance companies. I think that's a great idea too. So I don't want to keep anybody though. My presenters, I really appreciate you staying late, and the 100 folks that have stayed on. But thank you all. We have really appreciated everybody's comments and our panelists. Be on the lookout for a follow-up email, the slides from today's webinar, a recording of the webinar with closed captions, those continuing ed certificates, if you were one of those that was asking for that. You're going to hopefully get the upcoming SHEP plan scorecard from Kylia, and then ways to stay engaged with us. It sounds like there was really some interest in this to learn from each other. And so I'm looking to potentially build a listserv that we'll be able to share resources on. So look for that, hopefully in the follow-up email. And then the best thing that you could do for us is when you close out, there will be a short evaluation. So if you could fill that out, we would really, really appreciate it. All right, Fabiola, thank you so much for helping us with tech on the background, and it was wonderful. I appreciate you all. Have a good evening.